Now to our health alerts. A new study is now showing most people with prostate cancer can delay or avoid harsh treatments. The long-running study in the UK found those who partnered with their doctors to keep an eye on their low to intermediate risk tumors slashed their risk of life-altering complications. Our chief health editor, Dr. Partha Nandi, now joining us with a look at this study. And Doc, study's been going on for what, 2 decades now?
Yeah.
So what are the results?
But important stuff, right? So the study took place in the United Kingdom, and just over 1,600 men diagnosed with low to intermediate risk prostate tumors participated. Now, the men in the study were split into 3 groups. The surgery group, meaning that the tumors were removed. The radiation treatment group, where participants underwent radiation to shrink the tumors, or the active monitoring group, meaning the blood tests were done to watch PSA levels. PSA now stands for prostate specific antigen. So what did the researchers find, right? Well, the men in the monitoring group who did not have treatment avoided the risk of complications that could happen with the treatment. Complications can sometimes be life-changing, like urinary incontinence, erectile dysfunction, anxiety, and depression. Big stuff. Now, the cancer did spread a bit more in the active monitoring group, 9.4 versus 4.7% of the surgery group and 5% of the radiation group. But most importantly, there was no difference in prostate cancer mortality across 3 groups. There was a 97% survival rate at 15 years, and to me, that's really fantastic news.
Yeah, it sounds like it, but the study began back in 1999, so hasn't there already been some advancements in treatment? And for those that are high risk or high grade, should they do a wait-and-see approach? What should people be doing?
That's important stuff, right? Technology constantly changes, and there are new treatments like intensity modulated radiation therapy, brachytherapy, as well as robot-assisted surgeries. Nonetheless, there's researchers, Brian, that shows that outcomes are similar to this British study. As for men with high risk or more advanced disease, right, they need urgent treatment. While most prostate cancers grow at a slow pace, it can take up to 10 years before symptoms like trouble urinating and blood in the urine can develop. The cancer can be aggressive in about 10 to 15% of cases, and about 2.5% of all men that are diagnosed will actually pass away. So it's important that men between the ages of 55 and 69 talk to their physician about PSA testing. To me, that's super important. There's not a one-size-fits-all recommendation. It's individualized, right? But the good news is this, that the prostate cancer, if it's diagnosed and the cancer is in the early stages, then there's time to consider the pros and cons of treatment and whether or not it can be delayed or even avoided. And to me, that's the crux of it. It's not like, okay, good, I'm good to go, I'm not going to do anything. It's rather now we have options if you're not in the high-risk group, and talk to your doctor.
Good progress. If only we could eradicate cancer altogether, not have to worry about this at all.
Well, people are trying though, you know.
Yeah.
But just get your PSA checked and make sure you talk to your doctor about it.
All right, Dr. Nandi, grateful as always for
my
your
pleasure.
expertise. Thank you.
Of course.
If you have a health question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter.